Hello friends, another interesting topic for the medical students, the attendance. In every medical college, they are told at the start of the year that the attendance is compulsory, and if you don't have a certain percent of attendance, you will not be allowed to appear for the final exam. So this question is always asked by the medical students, whether it is really compulsory and do they really detain the students on the basis of attendance, and how much should be the how real is that threat or that danger. So I am making this video to allay some of the fears related to the attendance. Before we start, I'll give you a very interesting story about my medical journey. In second year, we used to have the subject of forensic medicine back in those days. Way back in 1989, 1990 was my second year MBBS. And I remember Dr. Singhal was the head of the department. He would conduct most of the lectures. Almost 95% lectures were conducted by him. And he used to say that a student who has attended 90% of my lectures, that was his claim. A student who has attended 90% of my classes has to just come and appear physically for the exam. He or she will pass the exam. Now, there was a catch in this. The catch was, in each of his class, at the beginning of the lecture, he would ask questions randomly to the students, the questions based on his previous lecture. And if a particular student is not able to answer that question, he or she was thrown out of the class. That means he will miss the attendance of that class. So out of that fear, the students would read the previous class content and would come well prepared for the next class. So obviously, if somebody has attended 90% of such classes, means he or she has already studied the subject very well. And that means he or she has to just be physically present in the exam. He will be able to attend and attempt and attempt all the answers properly, isn't it? Already studied well. So attendance being compulsory, here how it worked to the advantage, to the benefit of the students, because I remember in those days all the other medical college, the FMT forensic medicine result used to be 30-40%. That means 60% students would flunk in this particular subject because it was not considered as a mainstream subject. It is not even today. Forensic medicine is taken as like a sidey subject, you know. The mainstream subjects means they deal with clinical things, patients, disease, treatment, etc., like medicine, surgery. So forensic, not many people take interest in that subject. So not many people read that subject throughout the year, and they are likely to fail. But in our college, the scenario was exactly opposite. The students, out of fear, would read that. So, you know, attending a class here, and of course Dr. Singhal was an excellent teacher, no doubt about that. He wrote the book on forensic medicine, which became very popular later. But the point being, attendance here in this case had a certain different connotation, that you have attended my previous class, so you should be able to answer the questions in the next class. If you are not able to answer, you are thrown out. So out of that entire fear of losing out, the students would study the subject. Anyways, let's come to the topic at hand today, and that's about the attendance. Attendance, kitni zaruri, kitni majburi. That's the title of this video. Many times the students ask me this question: Sir, 75% attendance is compulsory. So if my attendance is, let's say, 74%, will I be detained? Well, I will answer this question later, but it's like RBC count. Let's say 5 to 6 millions per cubic millimeter is the normal RBC count. So 5 million is the lower line. If your RBC count is 4.9999 million, do you take it as anemia? No, generally not. I mean, just 10 RBCs less below 5 million, you won't take it as anemia. So obviously 74% is not considered as a low attendance in most of the universities. I'm saying when 75% is that cutoff line and 74%. So don't worry much about this 1 or 2%. Now let's see why the attendance has been made compulsory from the times immemorial. Why in medical colleges attendance has always been a compulsory thing. I remember my days. I mean, it's from some another era or another generation or 2 generations or 3 generations before this. Back in those days, we used to have only one textbook for each subject, 1 or 2 books, and we didn't have any of the resources which are available today. There is no social media, no YouTube, no online lectures which is available today. So lots of resources available now. Such resources were not available back in those days. So how do you get the knowledge then? The only way to get the knowledge is by attending the class. You have one textbook, so attend the class, then read through the textbook, and then you are preparing your subject. That was the pattern back in those days. Now in this era, when you have lots of content available for every subject, 10 to 15 textbooks in each subject, plus the video content available freely everywhere. So now what is the basis of for making the attendance compulsory? If you have this content available even outside the classroom, why then the attendance is compulsory? Why should we attend this class? We can get this anyways later on or outside the classroom as well. What I believe, so that's the question I'm asking, why compulsory even in this day and age? See, you make the compulsion to attend the classroom so that you get that information, and because that information is not available anywhere. That was in the previous era, previous generation, not now. Well, I think there are 2 reasons why attendance is compulsory even now. Look, we are our society is by and large a very patriarchal society, in a sense that we live under the constant guidance of our parents, and if there is no such pressure of attendance or parents, particularly if you're staying in hostel, there is always this danger that you have got a newfound freedom and you will not attend the classes at all, and then you will not study also. So that freedom might get misused, and then eventually you will lose the track of the studies. So by keeping the attendance compulsory and making you attend compulsorily, you remain in the subject, in the touch of the subject. You remain on the track. You know what's going on in the college, with what speed. So you are supposed to finish this much portion before the exam, and that brings a certain amount of discipline to your studies. If there is no pressure for compulsory attendance, if there is no pressure for internal exams, then your study will not have discipline. You will say, oh, I'll study later, let's see. So to keep you on track, this attendance being compulsory will help. You are compulsorily attending, you know what's happening in each subject, you know what's happening, what's required by each department, and accordingly your study will progress with a certain speed and certain direction. And second thing is, even though there are lots of textbooks and lot of material available in the outer world, it's a problem of plenty, as they say. This is a problem of plenty. You have lots of resources available, but then there will be a confusion. What to take exactly from the resources? Which resources are good? What things you should take from those resources? What to read? What you should emphasize on? All these things can be told only by an experienced teacher, and therefore making the attendance compulsory means you are attending the class and you get to know all these things as a guidance as to which books should you read, what is the correct content that you should follow, and therefore attending is always a good idea. Okay, and that's why probably they make the attendance compulsory. And you know, even the authorities might have realized that the times are changing. The lots of material is also available outside the domain of a medical college classroom. So they have brought in this concept of SDL, self-directed learning, and therefore now it is accepted that at least some part of your learning will be all by yourself. Everything will not be spoon feeding in the classroom, and therefore self-directed learning should be taken seriously by each one of you as you proceed in the medical college. All right. Now coming to the important question which is asked by all the medical students. We don't mind attending, but many of the classes we don't like or we don't understand what is being taught. So it becomes a wasteful expenditure for us attending the class. Instead, we could have been sitting in a library and studying that topic. We would understand it better. That is an argument given by many students. I'm not saying this is right or wrong, but yes, my philosophy has always been like this. You know, those who have attended my classes, they know that I have never taken attendance as such, compulsory attendance type. I always say this to the students: you should teach, a teacher should teach so well that a student feels almost compelled or inspired to attend your lecture. Student should, if the student is not present in your lecture, he or she should feel that he is missing out on something. Your teaching should be that outstanding and brilliant. So teach so very well that the students should feel, they should feel from within. That compulsion should feel from within. Oh, this sir's class I should never miss. I must attend this. So with this philosophy, I carried out, I went ahead in my career, and therefore I never took attendance. I used to say, don't come to my lecture only for the sake of that attendance. Okay, I'll give you the attendance, don't worry. Come and sit and listen to what is being taught. So yes, the teaching level also should match. But you should understand as medical students that those people who are coming in your classroom and teaching you, they are not professional teachers as such. They are doctors. Primarily, they are doctors with certain teaching skills additionally. So, not every teacher will have the best of the best quality of teaching. That's one part that needs to be understood. But even if, see, between attending and not attending, attending will be always better. Some students always complain that we attend but we did not understand anything. The teacher just shows the slides and goes away. Okay, but at least if you're attending, you will hear some words, some phrases, some important concepts, and then you will feel motivated to learn those concepts later on. So I always say, between attending and not attending is always a loss. Attending the class, even if it is little boring or little complex, you are not understanding, do attend, see what's going on, what is the topic, summarize that topic in your mind, and later on you can study that topic in detail. Now coming to another important point. If ever you bunk a class, what should be your approach? So first of all, I remember I come from that generation where bunking a class was a taboo. I mean, it was not acceptable, but still, I mean, people did bunk the classes even then. But if I am missing out on a class, if I am missing a class, bunking a class, then I would do it in a very subtle way that nobody should notice it. But these days, what I observe is that the students, they just walk out in front of the teacher who is entering the classroom to take the class. The students, they just, the word is audacity. They are so audacious that they would say, I'm not attending your, that's the gesture, as if I'm not attending your class, I don't like it, I'm going away, or I'm hungry, or I'm fatigued in mind. I would say that's not proper behavior. If you are bunking the class, at least be so subtle that the teacher does not come to know that you are walking out of the class. It's not due to the, I'm not talking about the ego of the particular teacher, but generally speaking, your behavior should be such, it comes in under the decency of behavior, that you should feel guilty about missing a class. You should feel, there should be a certain amount of feeling that you're missing out if you're going out of the class. So check your behavior, and if you're not attending the class, then before the next class you will finish that particular topic. That's the most appropriate response in the case you have missed out on some class. Now coming to the percentage, 75% in theory and 80% in the practicals. Is that really the strict benchmark, the strict percentage? By and large, it is strict. In many colleges, in many universities, they don't allow to fill the form if the attendance is low. But how low is really low? That's the question. As I said, 74%. Will I be detained? Well, no. There is generally always a grace or cushion that is given by all the universities. See, 20%, 30%, 40% is too low. That means you have virtually attended nothing. And in that case, be certain that you will be detained. But 74% or 70% or even 69%, 68%, that much is generally acceptable. I'm not saying, okay, you can miss classes. I'm not saying that for a moment. Not for a moment, I'm suggesting that below 75% and you will still be allowed. But I'm saying difference between a 30% attendance and let's say a 69% or 70% attendance. 68-70% attendance hai, still you might be allowed to fill the form as a certain amount of grace. So don't worry too much if your attendance is in the range but still below 75%. Well, if your attendance is 30-40%, then God knows what you have been doing in the medical college. You are expected to attend, particularly if you are a hostelite. I know many students who will walk in the medical college from the hostel to the college at 1 p.m. because they would never get up before 12:30. So obviously attendance would be 10 and 20% only. I would say finally, the final point here is plan your attendance. Your attendance should be planned. Why do I say that? Look, before any exam, and particularly prelims and finals, you get the leave, so there's no question on that. But before prelims or before any major internal exam, you will need some time for self-study. And that is a time when you will have to miss some of the classes so that you can study on your own in the library or in the hostel room or in your residence. So if you are going to miss those classes, then you will have to attend all classes now so that the things will balance out and your attendance will be still on par. So expecting this, anticipating that you are likely to miss some of the classes before every exam, attend now all the classes, okay, to maintain your attendance. So that means you will have to have a close look on your attendance every month. Periodically check your attendance. Go to the departments and ask for your attendance. See whether it shows correct percentage. It should not be come as a bolt from the blue, that at the end, toward the end of the year, you get to see your attendance and it is 60%. So no surprises, no hidden surprises. And for that, you should always periodically go to the departments, check out your attendance, whether it is up to the mark. All these things should be done on a regular basis. So keep a close eye on your attendance, and as I said, you will need the time before exams for your self-study, and therefore you will miss out some of the classes. So plan your attendance properly from this point onward. If the college fest is approaching, then you might miss some of the classes and attendance may not be given for those classes. So in that case, attend everything now, and then you can afford to miss some of the classes. Also, I have already mentioned how much less is really the less. 74% is less, 70% is less. See, that is left to the discretion of the college and the universities. Generally, they keep a benchmark, they keep a certain line, and below that line, they would detain the students. So 74 and 70% is still a decent attendance where you are not likely to be detained. I am not suggesting for a moment that 70% is fine, you can bunk the classes. No. But then, by and large, colleges, they see how much is the attendance, around 75% or just less than that, it's acceptable generally. Calendar method or rhythm method for attendance means, after every exam, in the immediate aftermath, you should attend all the classes. Okay, so that's how the plan should be. Immediately after the exam, start attending everything. People generally go in the reverse. After the exam, they want to relax, they miss the classes. But then if you miss the classes now, then at the end of the year, when you want to actually self-study, that time you will not get the time. You will have to attend the classes because you missed now. So after the exams, first internal, second internal, immediately attend all the classes. And as you approach the next exam, then you may start missing if you want. I mean, you should not miss any class. That's the rule of thumb. But anyways, you can decide which classes I want to attend, I must attend, and which classes I can afford to miss. That judgment should be taken at this stage, and accordingly go on attending your theory classes and practicals. Of course, you should not miss any practical at all whatsoever. So far, what I said was applicable to theory classes, but practicals, 100% attendance is mandatory. Mandatory in the sense that you are going to learn the skill in the practical. And if you miss that practical, then you are missing out on the skill performance. And therefore, if for any reason you miss the practical session, then it's your responsibility that go to the department and request some tutor that you have missed the practical and you want to learn it. You want to learn that skill. So that it does not become a festering wound for you. I don't know these skills, and at the time of exam, then if the department does not give revision practical also, then you are in a soup. Now how will you learn the skill? So remember, it's your responsibility to cover up for the missed theory sessions or the missed practicals and the skills. So this was about a general discussion about the attendance and the questions that are commonly asked by the students regarding the attendance. Many more such videos will come in the due course. So a good time to subscribe to the channel.